Otolithic catastrophe of Tumarkin in advanced Meniere's disease from dizzinessdoctor.com. Thank you. Thank you for your interest in dizzinessdoctor.com. If you're a person suffering from symptoms such as dizziness, imbalance, unsteadiness, disequilibrium, vertigo, etc., then our goal is for you to bring those symptoms under control. If you are a healthcare provider trying to help your patients manage those kinds of symptoms more effectively, then our goal is for you to understand better how to diagnose and treat the underlying disorder. Disclaimer: this material is intended for educational purposes only and does not substitute evaluation by a qualified medical professional. Accessing this material is subject to the terms and conditions detailed at dizzinessdoctor.com. Purpose of this presentation. The problem. I have been diagnosed with Meniere's disease and might be developing otolithic catastrophes of Tumarkin. The solution. We describe otolithic catastrophes of Tumarkin and their management strategy. Introduction. Some people with long-standing Meniere's disease develop drop attacks called otolithic catastrophes of Tumarkin. These were first described in 1936 by the British otologist Alexis Tumarkin. How common are otolithic catastrophes of Tumarkin? Meniere's disease is relatively uncommon. Otolithic catastrophes of Tumarkin tend to occur in patients with advanced Meniere's disease, typically meaning that the disease is unusually severe or has been present for many years. About 9% of patients with advanced Meniere's disease develop otolithic catastrophes of Tumarkin, though the literature cites a range of about 5% to 15%. Presentation of otolithic catastrophes of Tumarkin. Otolithic catastrophes of Tumarkin consist of very brief, seconds long, but severe perturbations of equilibrium that most patients experience as being thrown to the ground, hence the colloquial term drop attacks. These attacks are not preceded by any warning. They start abruptly and end abruptly. Most investigators state that these attacks do not involve loss of consciousness, though a few disagree. Mechanism of disease. Alexis Tumarkin speculated that these drop attacks resulted from dysfunction of the otolith organs, hence his phrase, otolithic catastrophes. Other investigators have proposed that the semicircular canals are the source of these attacks. Yet others have speculated that these attacks are attributable to perilymphatic fistulae. Video of otolithic catastrophe of Tumarkin. The former CEO of BMW, Harold Kruger, who reportedly suffers from Meniere's disease, had an attack during a press conference at the Frankfurt International Motor Show in September of 2015. The attack was captured on video.
Im absoluten Luxussegment verbindet Rolls-Royce Tradition und Moderne. Jüngster Beweis ist der Race. Auch der
Otolithic catastrophes of Tumarkin are different from typical attacks of Meniere's disease. Otolithic catastrophes of Tumarkin are different from the better-known Meniere's disease attacks because attacks of Meniere's disease are usually preceded by minutes to hours of ear symptoms such as hearing loss, tinnitus, and ear fullness. Attacks of Meniere's disease are usually followed by milder symptoms that linger for hours or even days. Otolithic catastrophes of Tumarkin are dangerous because they have no warning and because they are so severe. By the time a patient with Meniere's disease develops otolithic catastrophes of Tumarkin, the non-invasive treatments for Meniere's disease, such as dietary modifications and oral medications, are usually no longer effective. Other diseases can cause drop attacks. Note that drop attacks can be caused by other diseases as well, besides Meniere's disease. However, if a person with confidently diagnosed Meniere's disease develops drop attacks, then the likelihood is that these are otolithic catastrophes of Tumarkin from the Meniere's disease itself. Management of otolithic catastrophes of Tumarkin. A person suffering from otolithic catastrophes of Tumarkin should consult with a neuro-otologist, an otolaryngologist specializing in ear problems. Treatments for otolithic catastrophes of Tumarkin are ablative, which is to say destructive procedures, such as transtympanic injection of gentamicin, vestibular nerve section, or labyrinthectomy if the affected ear no longer has serviceable hearing. These procedures are ablative, which essentially means destructive, and thus they are irreversible. Therefore, your otolaryngologist will want to be extremely confident that such attacks are otolithic catastrophes of Tumarkin attributable to Meniere's disease, as opposed to drop attacks from some other cause. For this reason, before doing any such ablative procedures, your otolaryngologist will want you to have had a thorough workup, which usually includes tests of hearing, tests of vestibular function, and imaging of the brain and internal auditory canals. Thank you. Thank you for viewing, reading, or listening to this material, and for your interest in dizzinessdoctor.com. We welcome your feedback and support. The highest compliment you can give us is to refer our educational materials to others who could benefit from them.